In this video, we'll cover everything you need to know about supplementing in the first trimester of pregnancy. We'll go over progesterone supplementation and lab testing, N-acetylcysteine, why high-quality vitamins and nutrients are so important, and what my suggestions are to my patients when I'm seeing them in the conception period. Welcome. I'm Stephanie Grutz, board-certified family nurse practitioner specializing in integrative medicine. I've spent over 10 years helping women balance their hormones, help them during conception, and on their postpartum journeys to health and wellness. So today I want to talk about what supplementation is important during your first trimester, because as a new mom, typically people are unsure of what to take. They're told by their Western medicine doc just to take a regular prenatal over-the-counter with folic acid. And as you go into the integrative realm, you realize that not one size vitamin fits all, and you really should be taking some extra support that is really high quality. But first, let's talk about progesterone. So I have a lot of Amish patients that I see at my clinic. When I was starting out, they would come to me and they would come for fertility issues because they were having a lot of miscarriages in their first trimester. And when I would look at their labs, I would notice that they would have really low progesterone, suboptimal throughout pregnancy. And even the ones that did carry full term, sometimes they would have issues during their third trimester, maybe early term labors or pain. There was just different things that were showing up, and it was really relating to their chronically low progesterone levels, progesterone that was low even before conceiving. So I always tell women, if you can get to me before you've conceived, that's great, because I love to check everybody's progesterone prior just to get a baseline. But when you do conceive, I suggest right away checking progesterone levels, making sure it's in the optimal. I like to see it in the upper 3/4 of the normal limit. So you'll have a lab sheet. It might say between 10 and 25 is normal for the first trimester. You want to keep it up in like the 18s for that. Again, it just depends. The lab values depend on each lab company. But check it first time around, make sure that it's high. And then if it's low, work with the provider or get some support to use natural progesterone. We use bioidentical, which is made from a base of wild yam. So again, it's just like eating wild yams, except it's condensed into a specific form so you don't have to eat a ton of them. And it's just a safe cream that you can put on your skin. There's also capsules that you can take internally as well, just to help boost your progesterone. Personally, when I was pregnant, I knew that I've always had a history with low progesterone. So being a first-time mom, my iron levels, I really wanted to make sure were on par, and my progesterone. I looked, progesterone levels were low. At one point, I was taking topical on my skin, oral, and vaginal progesterone just to make sure that my levels kept up. I ended up having a healthy baby, full term, at home without any pain interventions or any interventions at all. And I was just really grateful that I was able to monitor my progesterone levels. If your provider won't order them for you, I suggest trying to find either a different provider that is more open to this possibility, or going to a lab, and you can usually run over-the-counter labs without having a doctor's order at times as well, like go through LabCorp or Quest. In general, just to again reiterate the importance, during the first trimester it's so important because around 8 to 12 weeks the placenta takes over progesterone production. So until then, you and the baby are relying on your progesterone only to support the system in growth. But once it hits around the second trimester mark, then the placenta starts taking over and producing its own. Doesn't mean that you might not still need support, because you do want your levels to always be higher, but you will get support from the placenta at around that second trimester. And again, we see a lot of first trimester miscarriages, and this could be one of the main reasons. Secondly, taking NAC. N-acetylcysteine is an antioxidant. It's a precursor to glutathione. Glutathione is a major oxidant in our body. And what NAC does is, it affects every system in our body. And I always have my pregnant ladies take 1 to 2 caps a day prior to conception. And then once they do get pregnant, take it up until 20 weeks of pregnancy, especially if they've ever experienced a miscarriage. There's studies that show taking the NAC up until 20 weeks can decrease the chance of a miscarriage by almost up to 400%. An amazing statistic, right? I also encourage in preconception time to have men take NAC as well. It increases sperm motility, strength, and endurance. So it's just making their sperm stronger for when you actually conceive the baby. A lot of people don't know that it takes 72 days for men's sperm to go through their full cycle. So around 3 months time. So you really want to make sure that the health of their sperm is strong as well. So I tell men and women take around 600 to 1200 milligrams of NAC a day, and then women carry it on through 20 weeks of pregnancy. I also love NAC for just a general antimicrobial. So if a woman is pregnant and they're in their second or third trimester and they're not wanting to take antibiotics or do anything invasive, they might have a UTI, they might have a respiratory virus or anything like that, I have them increase their dosing of NAC, and that usually does the trick. So NAC, always good to have in the supplement cabinet at your home. And then third, the quality of ingredients truly does matter. It's really important to take high quality nutrients that help your body absorb the nutrients that you're taking and utilize it in your cells. So like I mentioned, Western medicine will just tell you to go to CVS and grab a bottle of a multivitamin off the shelf. Well, typically that multivitamin is filled with fake colors, cheap preservatives, and fillers. A lot of times they have dyes that are carcinogens in nature to make the pill look pretty. It's like your body's working counterintuitively to detox from the actual supplement that it's taking. For example, folic acid is something that you hear constantly when you're pregnant. You need all this folic acid. Well, folic acid is actually the synthetic form of folate. You really want methylfolate to go into your system and your cells. A lot of people have genetic mutations. I'm sure you've probably heard of MTHFR gene mutation, but it doesn't allow the synthesis of synthetic vitamins like that. So I always tell people, like, folic acid is right here, and let's say it has to get to the cell here, here, and here. Well, in people that have genetic issues around that and aren't able to transmute that product, it will get stuck and it won't get into the cell level. So with like methylfolate and the higher folates, they start below and they're able to absorb into the cells appropriately. So it's so important to have high quality ingredients like folate, methylfolate. When you hear cyanocobalamin, the first part of that is cyanide. It's a toxin that your body has to detox. It's a cheap synthetic ingredient that we don't like to see in products. So if you see folic acid or cyanocobalamin in your multivitamin, go look right now. Just toss it. It's not worth your body taking. Go spend a little more money on a high quality product. Another thing that we don't think about when we're looking at supplements is heavy metals. So I own Select Balance supplements. You'll see some supplements on the shelves back there. We do third-party testing for toxins, ingredients, heavy metals. I know Lead Safe Mama is an account on Instagram that you can follow that they actually take different brands and they'll test their levels. As a supplement manufacturer, I or nobody else has to actually enclose or do any testing on heavy metals. So just for example, Lead Safe Mama tested Nature Made multivitamin. Nature Made is one yellow bottle. You see it on all of the shelves, and it had high lead, cadmium, and arsenic. In the prenatal folic acid and DHA, it had over 700% higher levels of the proposed safe levels and over 2,400% cadmium levels. So this is why it matters. They're telling us these are safe levels, but then in this industry, we're also toxifying people with it unnecessarily, and they're not getting the proper testing done or disclosing of that. Again, it's all about money for bigger companies like that are using synthetic forms. So if there's a lot of fillers, fake ingredients, ditch those. Get high quality supplements that actually do the rigorous testing. All that being said, my suggestions for pregnant women in the first trimester for supplementation is Prenatal Complete, 2 caps daily. This is just a basic high quality prenatal that has all the multivitamins and minerals in it with some iron, minimal iron to help hopefully avoid constipation. Pregnancy support, 1/4 teaspoon every day that you just mix with water. It's just a tasteless supplement. It has choline in it as well as folate and other B vitamins. Choline is as important as folate in pregnancy and conception. It helps with baby's brain growth, spinal cord development, and so many other mental health effects. And then fish oil, 2 caps daily. I love doing that for just general anti-inflammation, brain health, and support for you and baby. And then if testing for iron and iron is low, then I suggest doing an iron supplement on the side. But those are the typical supplements that I do think are very beneficial for just every general woman to take during pregnancy, and especially start them in their first trimester. As I mentioned at the beginning, checking progesterone, always really important. Checking your iron and ferritin levels right at the beginning, just to make sure your iron stores are up. Just think, when you have this baby, you're going to be losing some blood. So you want to make sure that your iron levels in storage are high, so that when you do this, that you will have enough in the reserve to feel good postpartum. Because after you deliver the baby and you have to take care of this new bundle of joy and yourself, you're going through this marathon, and I want you to feel really good afterwards. So if you do have iron deficiency and you're going into your third trimester, I always suggest in third trimester around 30 to 34 weeks, we'll say, and 32 is a sweet spot, get an iron infusion and let that help you assist into your birthing moment. So that's all I have for you. Everything you need to know about supplementation in your first trimester of pregnancy. I wish you the best, and thanks for coming to my channel. I hope to see you here soon.